Good morning. I'd like to call the meeting of the Employee Benefits Review Commission order at this time. Madam Reporter, please call it.
Councilmember Blevins.
Here.
Councilmember Feldhouse.
Here.
Member Phillips.
Here.
Member Friedis.
Here.
Did I get it right?
Sure.
Close. Member Claxton. Here. Member Lott.
Here.
Member Doak.
Here.
Member Holloman. All I have to say is you should have a name like Smith.
I'll let my father know.
I'm just
You're
saying.
We do have full attendance and able to conduct business. At this time, are there any comments from the public?
Okay, there's one signed up.
Okay, that brings us to new business. And the first and only order for the workshop is a Blue Cross Blue Shield presentation by Mr. Brian Johnson. John.
Good morning. Well, first of all, I'd like to start off by saying thank you. Thank you for the trust that you have put in Blue Cross for all these years as we've been your insurance carrier. We appreciate that. Don't take it lightly, and want to do everything we can to continue to earn that trust. I've got a few short points that I'll make as an overview of your current program. Then I'll turn it over to Jackson Carey, who works with Wendell Agnew, your broker, if that's okay with everyone. And then at that point, we can have some time for questions. So the first thing that I want to mention about your current program with Blue Cross Blue Shield Tennessee is that it's a customizable program, right? And what I mean by that is, unlike maybe a small group program where you have maybe a few choices that are already designed for you that you choose between, your program is a large group program. So because of the size of the city, you have the options to make lots of unique, specialized changes to your plan. For example, if you said, hey, I like everything about my plan except I wish my office visit copay was $5 less, we can go back and design that for you, right? If you say, well, I'd like to raise my out-of-pocket max just a little bit to pay for lowering the copay on the office visit, we can go back and design that for you. And so it's a very, very customizable plan. And so that's the first point that I just wanted to make sure you're aware of. You've got the ability to design the plan that really meets your members' needs best. Second, your plan being a large group plan, you are experience rated. And what that means is the rates that you pay are determined by our underwriters in large part based on the city's members' claims. So your own claims that are generated from your membership in the city of Shelbyville plan. That is in large part what determines your rates. And so what that means then is that when your membership has a good year claims-wise, a favorable claims year, and that should translate, at least to some extent, into the rates that you're paying. Now, there are some protections in place to prevent you from being, penalized if you have an extremely high claim or something to that nature. But for the most part, your rates are set based on your members' utilization. And the third thing I wanted to do was just to kind of give a high-level overview of some of the key points on the benefits that I thought might be good to point out. Jackson's going to talk a little bit more in terms of details on some of these. But you've got excellent pharmacy benefits. So you have copays on your pharmacy that are $15 for generic, $45 for preferred brand, $70 for non-preferred brand. And the one that I really want to underscore are these very expensive specialty drugs. These are the ones that you oftentimes hear advertised on television, and they can be $2,000, $3,000, $4,000 or more per month for members if they had to pay the full cost. your members get these specialty drugs for $140 copay each month. And so that's a very, very good copay for those very expensive drugs. I also mentioned that you have on your plan a fourth quarter deductible carryover. And that is going to allow for those who have claims in either October, November, or December of the year to benefit from carrying that deductible accumulation that they've had in those months over to the next plan year and benefit from that entire next year. And then finally, on the medical plan, you've got an out-of-pocket maximum of $4,000 per individual. And that applies for that individual, even if that individual is on family coverage. So whereas you have an $8,000 family maximum out-of-pocket, that family maximum out-of-pocket would come into play if you had two or more individuals that had claims, that were accumulating toward that $8,000. But let's take the situation where maybe only one of the family members has a large claim or has many claims that add up in that year, then that individual is capped out at $4,000. So that's protection for your members in those high claims years. Your dental plan is also very good with a $2,000 annual maximum, and your vision plan has a $0 exam copay. Now, Jackson's got some more details, but those are just some of the highlights that I wanted to bring up with the dental and the vision. Obviously, you can look at the full benefits to see all the different details, but that $2,000 dental and annual maximum is a very good benefit of the dental, and the $0 exam copay of vision is a very good benefit. Jackson.
Morning, everybody. As Brian said, my name is Jackson Carey. I've been working with Mr. Wendell Agnew for the past several months, assisting him on his clients. And so today I wanted to talk about some of the highlights of your current plan and compare them to the state plan. So the sheet that you have here in front of you that outlines the differences, we're going to be going through that, just showing you a couple of the key areas there. So as Brian touched on, and actually before I started, we weren't sure exactly which state plan that you're looking at. We kind of assumed you're looking at the limited plan because the premier plan and the other two plans were more expensive than your current plan. So the only plan that was less expensive was going to be that limited copay plan. So that's what we're going off of here today. We weren't sure exactly though which one, but that's what we've got the comparison here today, since the richer plan designs were more expensive than your current plan design. So as Brian mentioned, out-of-pocket max is arguably the most important thing on your health insurance plan. What that means, out-of-pocket max, is that's your worst case scenario. So if you've got $100,000 of claims or $1 million of claims, you're paying your max out-of-pocket. That's the most you could pay in a given year. So on your current plan, your max out-of-pocket for individuals is $4,000. So again, that's the most they can pay in a given year. For those that are on family coverage, it would be 2 times that amount, so $8,000 for family. And again, that can just give employees peace of mind, give them financial security, knowing exactly what their worst case scenario for the given year is. On the state plan, you can see that number jumps up quite a bit. Their individual max out-of-pocket is $6,800. So quite a big difference there. If you're having something catastrophic, or not even catastrophic, specialty meds, emergency room, maternity, things like that, you're likely to hit your max out-of-pocket for the year. So that would be quite a bit more money per year for your employees with that state plan max out-of-pocket. And especially on the family coverage as well, you can see it's quite a big difference there between $8,000 and $13,600. And feel free to stop me with any questions. I try not to speak too much in insurance terms and jargon, but if you have any questions about terminology or just any questions at all about the plan, feel free to stop me. So that out-of-pocket max is a very important number there. Another big difference between your current plan and the state plan is the state plan has a separate max out of pocket for specialty drugs. So whereas on your current plan, specialty drugs just apply like anything else towards your deductible and your max out of pocket. There's nothing separate. However, on the state plan, you have to meet a separate, an additional 2,400 if you're on specialty meds, for an additional 2,400 for individual, or an additional 4,800 for family for specialty meds. And specialty meds are those meds that you usually see commercials on TV for, those brand names. They got the big paid actors and things like that. Usually can be several $1,000s per month. I actually looked up the average cost of a specialty med is $7,000 per month. And we'll actually get into, when we get into the pharmacy section, we'll get into why that's going to be very important. So that's the differences in the max out of pocket. So you can see there, if you went with the state plan, it would be opening up your employees to a lot more liability, a lot higher liability per year for that max out of pocket. Next couple differences. This next one, the urgent care isn't quite as big. Your current urgent care copay is $50 copay. The state plans is $55, so not a big difference there. But this next line is a very important issue, very big difference. When it comes to emergency room, your plan has a $200 copay for emergency room, which is unheard of. I mean, that's unbelievable in today's insurance plans and things like that. You rarely, if ever, see a copay that low for emergency room visits. So if your employees go today, no matter what kind of emergency room it is, they're just paying $200. The state plan does not have a copay for emergency room visits. You're just paying the full cost up to your deductible, and then you're getting some coinsurance coverage up to the max out of pocket. So generally with emergency room visits, I mean, I saw a very minor one the other day that was $9,000. So typical emergency room expenses are probably going to be $10,000+. So on the state plan, if an employee has an emergency room visit, they're going to be paying several $1,000s, if not their entire max out of pocket. Whereas on your current plan, they're paying $200 there for an emergency room visit. So pretty big gap there in coverage. The next thing, and any questions on that before I move on? Again, feel free to stop me if you have any questions. And we can have questions at the end as well. The next line there is going to be your routine diagnostic lab and x-ray. So that's like blood work, x-rays, routine things like that are pretty standard with most office visits. You go get a physical, things like that. They're usually going to do some blood work. So on your current plan, there's no additional charge for lab and x-ray. It's just included with your office visit copay, which is a big key with Blue Cross that separates them from a lot of other insurance carriers, where Blue Cross just includes lab and x-ray with their office visit copay, whereas most other carriers charge you on top of that. And that's how the state plan works as well. For lab and x-ray, it's not included on the state plan with your office visit copay. It's in addition to, and it applies towards the deductible and coinsurance. So depending on what that is, it's usually lab work could be anywhere from $50 to $100 on top of your office visit copay. So that could be something that people notice pretty quickly, is they're used to just paying their office visit copay, and now they got to pay additional for blood work. So that's something that employees would notice pretty quickly. The next line there is going to be coinsurance, and this is one of those insurance terms that people seem to get confused about a little bit because it can be a little confusing. But coinsurance is that point in time of you've met your deductible, but you haven't met your max out of pocket yet. So you've met your deductible, so the insurance is kicking in and paying coinsurance for all your services. And so the first percentage that's going to be listed there is what the insurance is paying. So on your current plan, once you've met your deductible, Blue Cross, the insurance company, is going to pay 80% of your claims. You as the member would just pay 20% of the cost. So the higher that first number is, the better. You want that first percentage number to be higher. So 80-20 split on your current plan. On the state plan, it's a 70% coverage, and then you as the member pay 30%. So lower percentage there, and with that max out of pocket being higher on the state plan, you would see that difference there when you have some major things. So as I said, a bit less coverage there on the coinsurance on the state plan. Moving on to the prescription coverage, and this is where prescription coverage, while it's not always the biggest money amount, it's a very touchy subject because that's what people are getting every single month. You know, they're picking up their prescriptions every month. So if there's differences on that, people tend to notice it very quickly. You know, they've got budgeted for the prescription costs that they're used to paying. So if that goes up, you can generally, when we see dissatisfaction with plan changes, it's in the prescription coverage. So you've got different tiers of prescription copays there. Generics are $15 on your current plan. It's $14 on the state plan, so not a big difference there. And generics are usually less than the $15 copay. So if it's only $5, you just pay $5. But the differences start to show on the brand name medication. So for the tier that's preferred brand name, your current plan has a $45 copay. The state plan is a $60 copay. So about a $15 difference there per prescription per month. And then bigger differences go as we keep getting down the list to the more expensive medications. So non-preferred brand name, what I mean by preferred and non-preferred is every insurance company has different drugs that they prefer. So they'll give it to you at a lower copay versus drugs they don't prefer. So it's going to be a little bit of a higher copay. So on that non-preferred tier, your current plan is a $70 copay, which is fantastic. The state plan has a $110 copay, so $40 difference there. So that can kind of add up. If someone's taken, you know, a couple different brand name drugs, you know, you can see a pretty big difference every single month there in prescription costs. Now the biggest difference here, and what can really impact some employees and get some employees in a tricky situation, is going to be specialty meds. So as we mentioned before, specialty meds are your highest cost medications. They're kind of responsible for why healthcare has risen so much in the last 10 years or so. And as I said, the average cost of a specialty med I looked up is about $7,000 per month. So your current plan has a $140 copay for specialty meds, which is incredible. No matter what the cost is of that specialty med, your members just pay $140. The state plan does not have a set copay. Members just pay 30% of the cost. So if you take, for example, if the average drug cost of a specialty med is $7,000, the employee there would pay $2,100 a month for that specialty med. So their cost just went from $140 a month to $2,100 a month, up to that max out of pocket, which, if you remember, on the state plan has that additional max out of pocket for specialty meds. So annually, someone that's on a specialty med, they're looking at $6,800 plus $2,400. What's that? $9,200. So they're looking at $9,200 annually for that specialty med versus 140 times 12, which is $1,600. So that's an area that could really be a trouble point for some employees. Last thing I wanted to touch on at the bottom there was your dental. Most of the plan was very comparable, but there was a big difference on the dental annual max. So annual max on the dental is how much the dental insurance will pay out in a given year. So once they've paid out that annual max, then they don't pay anything else after that. Anything else on top of that number is on you to pay for. So your current plan will pay $2,000 towards dental expenses, whereas the state plan is only $1,500 towards dental expenses. And most people will meet that if they're having some work done, crowns, fillings, oral surgery, things like that. You'll probably use up all of your dental annual max there. So that's kind of the major differences in terms of plan design that we just wanted to make sure you're aware of. The vision plan was pretty much the exact same, so nothing to report there. But we just wanted to make you aware of some of those differences that could really impact employees. Any questions on this sheet before I go through a couple more things?
Does pharmacy ever contribute toward your deductible and out of pocket during the year? If you hit the maximum, then the out of pocket,
You're covered, yes.
then the monthly prescription costs go to zero?
Correct, yes, sir. Yes, if you hit that annual max out of pocket, then you don't have to pay anything else for any covered services.
And then the dental, where it says our plan is $2,000 max, you're not cut, that's $2,000 to the employee as such.
Correct.
It's $10,000, you cover the 8,000. So
Correct. You can think of that like a bucket of money. So they're giving you $2,000 in a bucket of money for you to use for dental expenses. Once that bucket runs out, they're not covering any more dental expenses. So the bigger that number is, the better.
who's not covering for you?
The Blue Cross.
Blue Cross is
Yes,
not
once
covering
they've, yes, once,
above the 2,000.
correct. Once they've paid out $2,000, they're not paying anymore.
So when you say that, the dental copay will go towards your individual max, that would be true on either plan. So like 4,000 for y'all, like for an individual, and I think y'all have 6,800 for
For the state plan.
the state plan. So nobody would get the 9,000 when we're talking about.
If they're on specialty med, they would, because the specialty med has an additional 2,400.
So your copay on the specialty med doesn't go toward your max out of pocket for an individual with either plan?
It does.
Okay.
Mhm.
Does your dental also carry over the last 3 months of the year?
It's a good question. I don't believe so.
That it ends the calendar year, right?
But yes, that is an important thing that Brian brought up about the fourth quarter carryover. So on your current plan, the last quarter of the year, any expenses that you accrue in that last quarter will carry over and apply to the next year. So someone, say that's like having a surgery in the last quarter of the year, they're going to get all that carried over to the next year. So they probably met the deductible and max out of pocket, so they're golden for the rest of the year. Whereas on the state plan, they would have to reset January 1 and just start over.
Jackson, coverage A is in addition to the $2,000.
On
Two
dental.
cleanings, x-rays, and so forth is in addition to the 2,000. On the state plan, it's 1,500, period.
Okay.
The 2,000 is on crowns, bridges, dentures, those. Cleanings and the x-rays, they're paid at 100%. Whatever that amounts to in a year. The two cleanings, it could be $200 or $300 or $400. So you got total actual benefit could be $22, $300 or $400, depending on what those paid benefits are. You have a great dental plan. Great dental.
But dental and vision are independent of the medical.
Correct.
Like a dental copay, or I don't even know what it's called. That max out of pocket is not, nothing's going toward the medical with
It's
that.
separate.
Those are independent, even though they're with Blue Cross.
Yes, ma'am. Yes, ma'am.
Jackson, do you have the stats on how many employees have used special drug coverage?
Yes, it was around 5 or 6 employees. Around 5 or 6 employees.
One of the things we're looking at with the state plan is the ability that it gives us options for our employees. If we buy into the state plan, if the limit of our employees are able to buy up to the better coverages, Is there anything you guys can do where you can give us a plan with options where we set a base plan and then give some buy-up options? That's generally the best thing we found about their plan versus what we have now, is we're locked into what's a very good plan for Mr. Agnew that we've not looked at for 20 years. That's part of why we're looking at this. This is our probably biggest expense that the city pays on a yearly basis that doesn't go out to bid. We've just been sitting on it for 20 years without at least looking at it. I mean, we go out and buy a $25,000 truck. We've got all these processes we go through. We spend $2.4 million in insurance. We're not even, doing any kind of background work. That's kind of why we're doing this now. But the biggest advantage to the state plan, and you may be able to offer this, is we can come in at the limited, but then our employees can buy up. We can even help them buy up to the next levels. And not everybody needs the 80/20. My wife and I, we're not super healthy. We're both about 50. I've not hit my deductible in 10 years, let alone my out-of-pocket maximum. So we've got younger, healthier employees that may not care about that as much, whereas we've got older employees that is more of an issue. Is there some kind of hybrid you can do like that, like the state is offering?
Yes, sir, absolutely. Yeah, you can technically offer up to 4 different plans. So, and you can customize those however you want. So you could offer a richer plan than this current one. You can offer a leaner plan than this current one. You can do HSA compatible plans. These are copay plans. You can, yes, sir, you can customize however you want. And sometimes we'll spreadsheet 6, 7 different plan ideas just to let the group choose from them. Yes, sir.
And Josh, back in the day, I have bid the business quite often.
Okay.
All of the insurance companies, but a short few years ago, I quit doing that. I was not selling, I was just trying to take care of my customers.
Yeah.
The one I've got now. But I did bid the business many times over this past 25 years. Of course, I've been dealing with the city 44 out of the last 50 years.
Yeah. Yeah, I'd be scared to death to switch to another company. I know that you did that in the past and people were unhealthy. I mean, I don't want to go to Cigna and get a bunch of unhappy people because they had to switch doctors and get bad coverage. We're not looking to do that. We're just looking at any options to possibly put more money in employees' pockets and nothing else.
And Jackson, he's Associated Benefits Inc. They're one of the top 5 insurance agencies, not only in Middle Tennessee, but the state of Tennessee. I went through a 3-year process for a large account that I handled and told them I would come up with 2 recommendations whenever I got ready to retire. And I'll let those 2 talk to you. You help me select which one you want. We selected Jackson Carey, and I made an excellent choice in that. He's got a staff that backs him. He can do so much more than Wendell Agnew. He's got 2 attorneys on his staff. Whenever they calling us about TennCare, Medicare, and what you change or so forth, he can go get those attorneys and they can answer those questions. It doesn't cost you any, that's just part of your benefit. The backup for Jackson and his development. And I'll just throw in there, his daddy's been the top salesman in the state of Tennessee for the past 10 years. And his granddaddy, who I worked with for 31 years, was also one of the top Blue Cross salesmen. He's Blue Cross all the way through, but he can put you all the other insurance. But there's only 3 or 4.
Right. Yeah.
Yeah, a lot of times we will take your coverage out to bid every single year, and we don't usually recommend moving carriers, but what we'll do is, say Blue Cross is coming in at a 5% increase, but Cigna's coming in at a 5% decrease. We'll take that back to Blue Cross and say, hey, you need to lower your rate. So it's more of just a leverage type negotiation there. But yes, to answer your question, we can offer 3 or 4 different plans that the employees can choose from.
To piggyback on what Josh was talking about, I'm under the family plan right now under the current insurance, and you're talking about the limited and then buying into the standard. And if I bought into the standard from the state plan, I pay $9,800 right now a year for our family plan. And if I bought into the standard PPO after going with the state plan, I would pay $8,500, and that would essentially give me a $1,000 raise for almost the same coverage that we're currently. Can you speak to that?
I don't have those rates exactly, so I'm sure your numbers are correct. So I don't, so.
They're Josh's numbers. But.
Okay, yeah, yeah, and that may be true for your situation. I don't know if that's true for everybody or if it would benefit everybody, but that may be true for your situation. I'm not sure.
Yeah, the biggest change, because we've looked at all these numbers, the biggest difference, for some reason, our pool is paying a lot more for any coverage that has kids attached to it. If we go to the state plan, the family or the employee with child, their rates are significantly lower. I don't know if it's because we have a small number of children in our pool or if we've had some high claims in our pool, but the state numbers that involve kids are significantly lower, like thousands of dollars a year. Yeah.
Yeah, I'm not sure the reason being, but we can adjust kind of the different tiers. So if we wanted to allocate a little bit more premium to the employee only and a little bit less to the dependents, that's certainly something we can look at doing to get those numbers more in line. Was the employee only more expensive on the state plan and less on the city plan, but the dependents were vice versa?
Their next step up, which is not the limited, their standard plan, overall, they're about roughly the same as yours. Now, for us, they're $37,000 more for the whole year, but their plan is January 2026 to December 2026, where we're currently rated July 2025 to June 2026. So we're right at dollar for dollar fairly. Yeah.
Yes.
Fairly
and I did want to, our next sheet that we can talk about in a bit kind of goes through the stability of your group and your last couple renewals. So I do want to get to that page, but we'll get there. But these questions are good.
Yeah. And thank you for coming in and giving this presentation. I guess I was under, I don't know, maybe a different idea. I thought you guys would come in and compare your different plans, not compare to what somebody else is doing. I think the ultimate goal here is to try to find a way to keep good coverage and save a little money for the city. So you say ours is customizable. I think I'd like to see some ideas, a couple ideas to where, all right, this is going to save you 5% if we do this. This is going to save you 10% if we do this. Comparing to the state plan versus what you have, I think we'd be better served if you told us what you could do. That's kind of what I thought we were doing. We were going to do to compare to a completely different plan. I think we've been happy with what we've gotten from you guys, but as costs keep going up and everything, what can you do? What can you present to us that might be a better option that doesn't hurt the employees, and, we stick with you. So I think that's what I was looking for. Maybe I'm wrong in that.
I'm right there with you, Buck. I really did think that we were going to get from you all the different maybe tiers or whatever it was that maybe we could look at, and then we as the employees can choose what tier in which we want to buy into from an insurance standpoint.
Yeah, because we haven't heard from these people, and to compare to them, I think it's what you provide, what you can provide and stuff. If we could have those comparisons and make good decisions out of the numbers that those come up, I think we're better served that way.
Because we're not just looking at the same plan, we're looking at 3 different options. So just showing us versus them, we just want to know the best for us that we can do, whoever's presenting, and let us compare, I guess, would be.
I just want to say at renewal time, Blue Cross did bring 3 or 4 options and presented them to Scott and I and Alicia. So every year at renewal, they brought different options. This would be cheaper if you do this, but the decision was made to keep it at this current plan.
Well, like I said,
so it probably still has that, but
we would just like to see that today, not that you never done it. I'm just saying that's kind of what we thought.
Well, they may not known that's what we wanted, but. I don't know
Yes,
what was
Stacy,
told to me.
I just had a couple of questions on the different options that you would be able to bring. If the city sticks with you guys, would that be an option for the individual employee to decide themselves, like where it could be, okay, well, we want the standard or we want this? So it could fluctuate and not be one across the board.
Absolutely, and that's what, when we have like our enrollment meetings with the employees, that's what we do is help them decide what plan is best for them. So yes, if there's 2, 3 different options, we'll sit down with them, go through each option and help them decide what's best for them and their family. So absolutely.
To follow back up on that, which I know, depending if that were an option, we had 3 different ones to choose from. Would that affect, like, if someone had child coverage, would that affect the number of children that they could bring on, or does that stay there's no max on that?
No matter how many children you have, the rate's the same.
Because that will be important too, to take into consideration whether or not insurances, different policies have a max.
Right.
Of
Yes,
children
whether it's
then-
one child or 10, it's the same.
Okay.
One follow-up question to that. If we have different options for our employees, and that's what you end up bringing to us, do we have to meet a threshold of certain number of employees that choose X plan over Y plan in order to make sure the city's costs don't go up?
No.
Okay.
One other thing I wanted to bring up, and y'all may be aware, but Wendell used to come monthly to sign people up and explain the benefits to all the new employees, and if people had questions. My understanding is Jackson's been doing that now. So that's a benefit they offer. The others may offer that too. TML may come once a month. The state may come once a month. But we just, is that what you do? I mean,
Yes,
monthly?
any service matters that you all need. So any employees that have a bill that doesn't look right, or a prescription that's not being authorized, any service matters that comes through us as well that we can assist your team with. So yeah, any service needs, compliance needs, enrollment needs, anything like that, our team can assist you with that.
We currently are taking a big load off of the city of Shelbyville and the arrangement you have now. When you go under the state plan, which you don't have, to my knowledge, that type of support. I spend as much time as necessary explaining to employees.
You can speak to your attributes without being critical of other considerations.
We just want to hear what you guys have.
Yeah.
That's what we want to hear, the options that you have.
And that is appreciated.
Yes.
Also, that especially the
But a
administration.
question for the committee. It appears that I've done our 210 covered employees somewhat of this service, because as the city treasurer explained, me, her, Alicia, and Wendell have sat down, like, okay, only 5%, this is good, let's go with it. And then we bring that recommendation to the council. So what I'm hearing is that we really need to explore the various options that could be presented and not have a select few make the decision, but be somewhat open and have a good discussion. Is that kind of what the direction?
I think now that we have this committee, and if we go forward with it, I think when those options come in at the end of the year, like they said, I think that'd be a good time to review it and at least get some feedback on it.
Yeah, again, I mean, this is dollar wise, one of the biggest things the city does every year. I think the more heads we can get together, for taxpayers, for employees, for everything, it's a good idea. So it's time well spent, I think.
It's usually around April or something. Is that right? April or early May?
Any additional questions? Okay, got more?
Yes, I'll be quick. I did want to just touch on the next page that you have there. This page right here has the renewals.
Thank you.
So honestly, one of the most impressive things about your plan is how well it's run the last couple of years. I mean, as you all know, insurance trends have been crazy for the last decade. Insurance plans on average have increased by about 10% every year. This past year, that trend actually went to 13%. So anywhere from 10 to 13% is about what most groups have had to deal with over the years. Your plan at the city has averaged 3.42% rate increase each year, which is incredible. I've never seen a group run that well. So in terms of stability from year to year, you're doing great. You can go through there. This goes back to 2018. So in 2018, you had a rate hold. In 2019, you had a rate hold. And then in 2020, you had a slight decrease. I mean, that's unheard of. And then you had a couple of increases from 22 to 25. But again, all of those were below the average trend. So y'all have had it really, really good here. Wendell's done a fantastic job, and Blue Cross has done a fantastic job with your renewals each year. And your employees have been a great pool in terms of claims and everything. And we actually looked up your claims for the past couple of months, and your claims have been running really well the past couple of months as well. So the stability that you have on your current plans is a huge thing. And a lot of times when we see, when you do start to make changes or things like that, sometimes that can affect those renewal increases. That's really all I wanted to touch on that sheet. There's a little bit more on there. You had a couple of large claims back in 22, but really even those large claims didn't blow up your plan or anything. So really good there. The last page I wanted to.
I'm assuming that under the increases, that you're never going to give us some sort of guarantee of max percentage increase.
Not usually. I've seen carriers do it every now and then, but it's pretty rare, especially since you've been with Blue Cross forever, they probably wouldn't do that. Sometimes if a new carrier is trying to get really competitive, they'll do a rate cap on renewal, but it's very rare. But this last page here, Wendell actually went around and talked to a lot of the local municipalities, just to kind of get a feel who was on the state plan, who wasn't. And Wendell had mentioned that back in 1993, the city actually went to the state plan for a couple years, and then moved back to having their own plan very shortly after. But he contacted the cities listed there. As you can see there, 6 of those were directly contracted with Blue Cross, so doing their own plans there, and then one of them was with Cigna. He also spoke to a local state government, which mentioned that the state plan of Tennessee has been using COVID money ever since 2020 to kind of offset renewal increases, and that's what we've seen with other state programs, other things like that. They've been using COVID money to offset renewal increases. But that money from what we're being told, would be going away next year. So I don't know exactly what the state plan has averaged on their renewals. I've been told about 5 to 7% has been their average each year. So without that COVID money, that could jump up. So, if that would just be something to consider if you did move to the state plan. Potentially there could be higher renewals in the future.
I wanted to go back to the other sheet of when you're doing your, I guess, look back period for the previous claims, how far back do you go and how long does it take for a large claim to fall off?
It's a good question. About 12 months.
I'm sorry?
About 12 months.
About 12 months? Okay.
Yeah, so you wouldn't be penalized for those large claims back in 22. Those are long gone and forgotten. So
when you do the renewal, you just basically look at the last 12
Yes, ma'am. Yes, ma'am.
Do you have any facts or figures about how many, what is the total number as far as claims for this last
We could get
last
that.
calendar year?
We could get that for you. I don't have it, do we have it off the top of our head?
No, but I did want to mention that there's a pooling component. We talked about the experience rating nature of the formula. And so there is some accounting for the fact that we know if you have one member that has a really high claim, which can happen, right? You could have a car accident or a premature infant or something like that. They could have $400,000 or $500,000 from one person. That might be an anomaly. And so the underwriter is going to say, well, there's going to be a maximum that we're going to even count of that claim toward your projected claims going forward. And so they're going to take off the vast majority of one of those, super large claims and just project a smaller amount going forward. Because we know that it wouldn't make sense to assume that you're going to have that $500,000 claim every year, right? That wouldn't make sense. So there is a provision that accounts for that. And then there's some other, provisions too, where the underwriter's trying to balance, if you have a super high year, just as, as your whole group, there would be some weighting that would come into play. Well, how does that compare to our book of business? Or if it was a super low year, there might be some weighting. How does that compare to our book of business? But for the most part, you are experience rated. And so if you see your claims go up, you might see that affected in the rates. And if you see your rates, your experience go down, as we've shown, there have been at least 2 years in the last, 10, that you got decreases, and that was directly a result of the city's claims. I can almost guarantee you we did not give the rest of our business, decreases that year. Those were specifically because of the experience of your book.
Okay. I know that you don't have the number of the actual dollar amount of what we claimed last year.
We could get that for you.
I understand that you don't have that. But can you at least ballpark it and tell me, did we exceed $2.37 million in claims last year?
I don't think so.
I don't have that number, I'm not sure.
We could get that for you, but I don't think so.
I have another question. If the city decided to stay with Blue Cross, but go to that where each employee could look and choose their own plan, would that fourth quarter rollover still apply to all those plans?
Yes, ma'am.
Okay.
Any additional questions?
No.
Sir, any closing?
That's everything.
Thank you.
Thank you all very much.
Thank y'all. I'm sorry, I was gonna do your job.
If there's no additional questions or comments, we'll declare the meeting adjourned.
Don't go anywhere. We'll be back.